because we talked about the location of the prostate, that it's below the bladder, above the pelvic floor, it's a very hard place to evaluate. And I'm sure most of you have heard that the only way they evaluate is with a rectal exam, which is true. I mean, that's the best way. But if you think of the prostate as a bagel with a hole in the middle, if you feel the backside of a bagel, you have no idea what's going on the lateral sides or the front of the bagel or what's going on in the middle of the bagel. So if any of that physical exam alerts the doctor that there's something not right, further investigative studies are going to be required. One of which is a blood test, a prostatic specific antigen. Not a great test, but a test that is a chemical marker that is produced only by prostate cells. An elevation of a PSA is not an indication of cancer 100%. It's probably only 50% of the time an elevation in the PSA is cancer. But that information, along with the sequential following of that lab study, helps to give the doctor information that allows him to paint a picture that he clearly understands and understands your disease and your situation. Even a bad test gives you some information, and when repeated enough, will help give you a picture. Nobody could tell you the story of Gone with the Wind with one film out of it, one film shot. But if you run the movie for a while, you start to understand what it's about and where it is. And the same is true with our body. That information is critical.